Remove the top sheet and blanket, then turn your patient to one side. Remember, if the patient can't turn themselves, you're going to need a helper for this part. Then you're going to remove the fitted sheet from your side of the bed, one corner at a time, and roll the linens inward towards your patient. You want to kind of tuck them up under the patient's back or hips. Then you're going to get your new fitted sheet and secure it to the corners of the bed and drape it up over the patient for a minute to give you a chance to lay out your draw sheet and your incontinence pad so they're centered before you start rolling up the sheets. Now, a little pro tip here, I actually make my full bedroll before I start. That way all the sheets are already centered and all I have to do is lay it out, secure the fitted sheet, and tuck it under the patient. So once you have your clean sheets laid out, you want to kind of roll or fan fold them towards you and then tuck them up under the dirty sheets that are already under the patient. Now, if you need to, you can place a towel between the dirty and the clean sheets to protect them. Now you're going to have the patient roll back over the linens. I always say something like, okay, you're going to roll over a big hump in the sheets now. So once they're on the other side, gently, carefully pull out the old linens. I usually just keep rolling and tucking them to keep from splashing or splattering anything. You also kind of want to keep from having the old dirty linens touch your scrubs. So once they're off, again, roll them up and throw them into the linen cart or the linen bag. Then you can pull the new sheets out from under the patient and secure the fitted sheet in the corners. As you're securing and laying out these sheets, you really want to make sure that there's no wrinkles in the draw sheet or the incontinence pad. Even wrinkles in the sheets can cause pressure ulcers in high-risk patients. And then you want to roll your patient on their back and make them comfortable. If you haven't already, make sure that they have a nice clean gown on. And then you're going to cover them back up with their sheets and their blankets, tuck them in, make them comfortable, and make sure that they're warm. Now at this point, you can change the pillowcases. Now we're going to show you our cool trick. First, of course, take the old pillow out, or the pillow out of the old pillowcase and throw the pillowcase in the linen bag. Again, being careful not to allow dirty linens to touch your scrubs so that you can stay uncontaminated. So then the cool trick is to grab the corners of the pillowcase and turn it inside out. Then you're going to reach in and grab the corners of the pillow and unfold the pillowcase around the pillow. That just gets it most of the way on, and you can shake it down to get it the rest of the way in. Just keeps you from having to fight with the pillowcase. So give your patient their new pillows, prop up their arms, make them comfortable, and then you're all set.